More on the coronavirus story. Joining me now, Dr. Kerry Chant, the New South Wales Chief Medical Officer. Thanks very much for your time. Can you tell us, first of all, about the latest with New South Wales confirmed cases and any suspected ones?
So we currently have confirmed 3 cases of the novel coronavirus infection and have 4 cases under investigation, one of those being probable, and we are expecting confirmation of those results later today.
The disease itself and what we know about it, the one bright spot seems to be a relatively low fatality rate, albeit that this could mean a lot of fatalities if a lot of people are infected, but of about 2%. Is that still the understanding of this virus?
Early on, the estimates are challenging to validate, and that's because often the sickest people get tested, and therefore the estimates early on tend to overestimate the mortality rate. So I think we're cautious. I would like to be cautious before I confirm the mortality rate, just for those reasons. But people should be reassured that across the world, the best scientists are looking at this. World Health Organization is working with Chinese officials to, as quickly as possible, confirm some of these important estimates that will inform our response.
So it might well be lower, you're indicating. Nonetheless, it's making people pretty sick that contract this virus.
What we know about it today from our cases is that there clearly is a variety of different ways in which the disease presents. Obviously, you've heard about the more severe cases that are presented in the context of Wuhan. Our cases have, whilst currently in hospital in isolation, those cases are generally being certainly milder than not requiring ICU admission, and certainly not the more severe end of this spectrum.
The incubation period has been a big talking point as well. It can be up to 2 weeks. The concern as well, Chinese authorities are saying that the virus can still be passed on during that point when people are not symptomatic over those 14 days. That must be a concern in terms of trying to limit the spread.
Those reports occurred overnight, and we're currently trying to verify the data upon which those reports have been made. Obviously, that's a very important piece of information if it's verified. It is different from our experience with other coronaviruses such as MERS and SARS, where people were basically infectious after onset of symptoms. So that's something that we are working rapidly as we speak to try and verify, because that obviously has implications, as you point out, for our response.
Right, so that hasn't been confirmed at your end. How do you go about that process? Is it reaching out formally with China? Is it our own testing, which is obviously relatively limited in Australia, given only a small number of confirmed cases?
That piece of information is something that all health authorities across the world and China will be wanting to understand, and so we're working together to understand the basis for those reports that have come overnight and to confirm the best expert advice on the accuracy or otherwise of that.
There was one case I just want to take you to, a male in his 50s arriving in Sydney from Wuhan, China, on a China Eastern flight number. That was on 20 January. It does seem surprising that, given we knew of this disease at that stage, that there were still direct flights from Wuhan to Sydney at that stage. Why was that the case?
The situation was rapidly evolving, and our normal controls were in place. So sick passengers have to identify themselves, and pilots have to identify sick passengers on board. We have the Commonwealth has biosecurity officers present and an ability to link with state health departments should passengers on planes become unwell, and the usual processes were in place. Obviously, we strengthened that by meeting the plane that arrived last Thursday with the direct flight from Wuhan. But I think it's very important to say that because of the incubation period, being conservatively up to 14 days, often people arrive and they're perfectly well and don't develop symptoms until later. And therefore that is one of the challenges, that no, border protection will not prevent the virus being transmitted.
But wouldn't that make it, to truly be conservative, once this outbreak was confirmed in Wuhan, wouldn't it make even more sense not to allow direct flights, because then at least it delays the time at which someone can go from there to Australia with this longer incubation period?
Patients can travel to Australia via various different routes through many different airports, and so our flights from China, but people can come in through other nations' airports, and so in a global environment this is one of the challenges we are confronted with. We did act quickly and with our colleagues in the Commonwealth who are responsible for border measures, and have supported the activities of the Commonwealth by deploying health teams to attend flights when there's been any concern, and we deployed 8 doctors, 8 staff to that flight on direct flight from Wuhan, and information was provided to everyone on that flight.
Right, yeah, and that sort of information saying contact authorities if symptoms begin and so on. I wanted to ask you finally, if I could, about the 100 children, estimated 100 children in Wuhan at the moment. What's the process with their potential evacuation if that does happen at the federal government level? What happens for anyone in New South Wales? Will you have a specific sort of hospital or facility set up for isolation?
We are meeting with the Commonwealth today. I'll be updated on any situation and plans that the Commonwealth have for repatriating those children, and we will support our colleagues and will support the residents of New South Wales. So it's premature to comment at that. Certainly it's an area that we'll explore with the Commonwealth in terms of what their plans are.
And I'll ask you finally, broadly, what would be your message to Australians out there that might be concerned right now about the spread of this virus, particularly, I suppose, those with people in more vulnerable categories, children and older people as well?
My message at the moment is we are trying to detect any cases in New South Wales, and so the message is largely to people that have come back from Wuhan, but also China more broadly, to be alert for symptoms. If you've been a contact of a case that's been diagnosed in China and you develop symptoms within 14 days, please present and seek care urgently. What we are asking you to do is either ring your GP, and your GP might say it's best that you go to the emergency department, or go directly to your emergency department, or you can ring the Health Direct number. The main message is please come forward and get tested. We have got the testing available. We have waived any fees for those people that might be Medicare ineligible and don't have private health insurance. So there is no barrier and fees associated with attending our emergency departments if you're presenting for novel coronavirus testing. So the main message is please come forward. We will treat your information confidentially, and we will manage and care for you and diagnose you promptly.
All right, Dr. Kerry Chant, we know it's a busy time for you. Thanks for your time today on Sky News.